Hey there folks, this is Larry Chu here, and welcome back to our discussion about the future of medical education and how patients can help expand the conversation about how we in academic medicine can play a role in changing how medicine is practiced by promoting participatory healthcare models, shared decision-making, and by implementing new patient-centered outcomes research and clinical comparative effectiveness research. In this episode, we're going to learn about differences between patient-centered care, patient-centered outcomes research, and clinical comparative effectiveness research, and why it's important to understand these differences and some practical things to consider on both sides as we try to put ideas into action. Just a couple things before we get on with this episode. A few things to mention. Don't forget to click on the subscribe button over on the MedicineX YouTube channel. That way you'll get to know when any new videos, if you like this kind of content, are posted. It's also a kind of a way to let us know that you're out there and you like us. Don't forget to follow us on other social media channels for updates, including our Facebook and Twitter channels. Okay, so let's dive into the topic of understanding the differences between patient-centered care, patient-centered outcomes research, and clinical comparative effectiveness research. Why is there so much confusion around these terms? So, in a recent study by Laura Forsyth, a research from PCOR and her colleagues, which was published in 2015, nearly half of 750 primary care clinicians they surveyed online were not familiar with the term clinical effectiveness research. But here's the interesting thing. Once they actually reviewed the definition, most, 3/4 of them, agreed that it can improve patient care. And not just that, the majority of patients and clinicians surveyed in that study were interested in engaging together as partners in that type of research. So what was the biggest barrier to engaging in clinical comparative effectiveness research? It turned out it was lack of time. Let's take a little time ourselves right now to understand our terms and understand why they can improve patient care. So what is comparative effectiveness research? We can start by defining what it isn't. It isn't research that focuses on discovering new molecules or new treatments. It isn't basic science research involving lab rats or mice or cells in a petri dish. Comparative effectiveness research directly compares existing healthcare treatments to find out what will work best for which patients and also to figure out which pose the greatest benefits and harms. The Institutes of Medicine describes the purpose of clinical effectiveness research is to assist consumers, clinicians, purchasers, and policymakers to make informed decisions that will improve healthcare at both the individual and population levels. Patient-centered outcomes research is defined by PCOR a little differently than comparative effectiveness research, mainly in ways that make it more inherently focused on the patient. It is research that helps people and their caregivers communicate and make the informed healthcare decisions, allowing their voices to be heard in assessing the value of healthcare options, and answers patient-centered questions to help navigate healthcare decisions. So you see, patient-centered outcomes research is a broad category of research that emphasizes questions that are important to patients and other healthcare stakeholders. So some, but not all, patient-centered outcomes research is also comparative effectiveness research. And not all comparative effectiveness research is patient-centered. Are you still with me? I hope so. Finally, let's tackle the last definition, patient-centered care. Patient-centered care is the practice of caring for patients and their families in ways that are meaningful and valuable to the individual person. And we do this by listening to, informing, and involving people in their own care as partners. Through a process called shared decision-making, clinicians and patients work together using clinical evidence and research to select tests, treatments, and care plans that balance risks and expected outcomes with a person's preferences and values. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. At Medicine X, we believe what underlies the ability to provide patient-centered care is trust and mutual respect in healthcare teams, where patients are valued members of those teams. You'll hear more over the next few months about how we approach building trustworthy relationships at Medicine X. But let's start by hearing from a patient herself. I recently asked Jasmine Sturr to visit our Medicine X studio to share some of her thoughts about patient partnership in medical education, and everyone included. Let's hear from her now.
So I have juvenile onset Parkinson's disease. I am 23 now, and I've had it since I was 14 years old. I was sort of diagnosed at 18. Following 4 years of misdiagnosis, I was diagnosed with the Parkinson's mimic disorder. And so I had a really good 2 years from 18 to 20, and then right after I turned 20, my health sort of declined. And I had deep brain stimulation surgery at the end of my junior year of college. I had a second brain surgery in December of my senior year of college. The brain surgery was highly successful. It's the reason I'm able to sit up and talk and move around today. I had some very severe motor deficits and some motor defects that were just very disabling. Pretty much as soon as I had gotten better from the surgery, I had my gastroparesis develop secondary to Parkinson's. So my stomach doesn't contract the way it's supposed to. So any food I eat basically will just sit in my stomach until I will eventually get sick from it. And so I was down to 100 pounds at 5'8", and they decided to put a feeding tube in. Around the time I graduated from college with my chemistry degree, I basically had to go home to get healthy and to survive, because I started total parenteral nutrition, which is being fed through an IV. So I have a central line in my chest that I run nutrition through every night, and I get all my medication through my feeding tube that goes into my small intestine. When I was done with college and I kind of had to go home and find something else to do for the time that I needed to sort of get better, I got very involved in sort of the patient community, in providing educational services to the Parkinson's community, using my chemistry degree to be able to share the basic knowledge of how our medications work so that patients can have the ability to empower themselves to understand how the disease works and understand how their treatment works so that they can better dialogue with their neurologists. I sort of also started experimenting with different ways that I could modify my medications to improve my own treatments. A lot of times when they define research outcomes, they're looking at survival rates and they're looking at sort of the classic symptoms. But I don't think that the research outcomes are necessarily the things that affect me on a daily life. This morning I was just talking to my dad. I said, why has nobody figured out yet how to create some medication that makes getting out of bed in the morning easier, that makes waking up not like a wave of pain that takes over my body when I try to move in the morning. And I think that's just because you can read about Parkinson's all you want in a textbook, but you're never going to understand what it's like to wake up with your body just going completely stiff from lack of dopamine until you have woken up there. And so I think that's why patient-centered research is important, and why what I think that the definition of it is research that's focused around what people want, not just on a broad spectrum of disease curative treatments or disease altering, disease modifying treatments, but also on things that are going to affect our daily lives. Because the moments you live in between getting a disease and this ultimate treatment and cure for it, those matter. I think the best way that researchers can reach out to patients is to join a patient group. I know with Parkinson's, we have World Parkinson's Congress. It's really this amazing conference that happens every 3 years that brings together researchers and doctors and clinicians and patients. And my favorite story from World Parkinson's was this woman. It was this panel, and she comes up and she says, "I'm 44 years old and I have Parkinson's, and I want to know why researchers aren't knocking down our doors trying to study us." The researcher had said that the best way that she could be involved was to donate her brain upon death. The whole room sort of stopped and went, "Oh my gosh, you just told this woman the only way she's useful to you as a researcher is to be dead." And that's just so not okay on so many levels. I've been really fortunate to know a movement disorder specialist. He's a neurologist who treats Parkinson's. He has, on Facebook, has connected with a ton of patients. By knowing patients and seeing what they go through in their daily lives, he has a much better idea of what his patients go through than the 30 minutes he spends with them in his office every couple months. One of the most incredible things about going to college for science and being a patient is that my classmates, my friends who I went to college with, who we grew up in our science education together, a lot of them are in grad school and medical school right now. And so often I get a text message from some of my friends who are working in ERs. I would get a text message saying, "Oh my gosh, I had a patient today at my job who had dystonia, who had Parkinson's, who had a feeding tube." And so often they would say something to the effect of, and the primary doctor in this case didn't understand this patient, but I said, "I do. I understand. I have a friend who I've seen, who I went to school with, who had this." And that to me was so rewarding because they then took seeing that patient as a patient and equated that with someone who they consider a colleague and who they consider someone at their level. And I think that's the most important thing that we could be doing, is showing med students and emerging scientists that these are not just patients who you're serving, but they're your colleagues. Bring patients into medical school classes and have them tell their stories. Because the more that early on you break this sort of power dichotomy and you break this power structure and you get young physicians seeing people as people before they see them as patients and understanding the impact that a 5-minute doctor's office visit that you might not even think is a big deal, how that could take someone like me and could ruin their life. That understanding underneath it, that this decision is more than just a decision, it's a part of somebody's story.
So to wrap things up, how does this relate to medical education? We learned that patient-centered outcomes research and comparative effectiveness research are related but different topics, and that they are both important to generating new knowledge to help patients make better and more informed decisions about their care in partnership with their healthcare team. We also learned that patient-centered care involves caring for people in ways that are meaningful and valuable to the individual person. And we can do this through a process called shared decision-making. As medical educators, we can help our students understand that patient-centered research is important to people like Jasmine Sturr, because it is research that is focused around what people want, not just disease cures or disease-modifying treatments, but things that affect and improve people's lives every day. Jasmine noted that while people who work in healthcare often focus on diagnosis and cure, they often forget about the moments that people with these chronic conditions live in between. And those moments are the moments that matter most to patients. And as Jasmine mentioned, one of the best ways educators and researchers can reach out to patients is to join a patient group. By making personal connections with patients, they can gain empathy for the human condition and respect for the expertise of the experience of living with the chronic condition. Finally, medical educators might remind their students that patients bring unique insights and expertise to the clinical encounter. And as Jasmine noted, to think of patients as colleagues you can bring into the classroom to tell their stories. What's on your mind after watching this episode? We want to hear from you. Leave us your comments below. If you're an educator who's partnering with patients, let us know what's working for you and what you found as your greatest challenges. And if you're a patient, how have you seen partnership work from your side of the process, and how could you see the process improving? For everyone out there, what's the one misconception or misperception you think the other side has about you that you'd like to clear up in order to help build better working relationships going forward? Well, that's it for now. I hope you've enjoyed this episode. A quick reminder, make sure if you haven't done so already that you subscribe by clicking on that subscribe button. And if you like the video, click the thumbs up button. And I'd really appreciate it if you share the video with other people you think would like to see the content that we're posting here on YouTube. That's it for now. We'll see you next time.